By the way, congratulations with your 150.
Oh, yes.
Oh, yes.
What Longrich has introduced to us. For me, I see God in everything. Because the bottom line is, God in 6 days, He created everything that we know, life to live, right? And on the 7th day, He rested.
Good evening to our viewers. Good evening, Dr. Lesego.
Good evening, Pastor Jerry.
How are you?
I am blessed, and you?
I'm truly blessed.
Wonderful day.
We're still keeping our distance?
Yeah, I'm sure it's a meter.
Yeah. All right. Now, thank you so much. We are actually going on from where we left off. We were inundated with a whole lot of questions with regard to stroke. What is a stroke?
Okay, so this is obviously following our previous recording. Yeah, we've had a couple of members and, asking us to, do a special recording on stroke, and this is the reason why we are here today. So in simple terms, a stroke in medical term is called a cerebrovascular accident. So that means that a stroke is something that occurs inside the brain. So a stroke happens when there is an interruption in the flow of blood to the brain. Now remember, the brain serves an important function of regulating everything that has to do with the body. Now, as soon as there is an interruption in the flow of blood, then a stroke may occur. And there are obviously different causes of a stroke. So in simple terms, a stroke occurs as a result of interruption in the flow of blood inside the brain.
All right. You spoke about cerebellum, something. What is the abbreviation? Which is the shortest way?
Yeah, so cerebrovascular, it's a term that's usually used within the medical fraternity. It's a CVA.
CVA.
Yeah.
Wow. Write it down. And what are the causes?
Okay, of a stroke. So there are obviously different causes of a stroke, but today I just want to highlight on one, which is high blood pressure, but we also have sugar diabetes that can cause a stroke, and we also have some risk factors. So those are the things that would put an individual at a risk of having a stroke. So age is one of them, obesity is one of them, high cholesterol levels, one of them, stress is one of them, and many other lifestyle issues. So in terms of high blood pressure being the cause of stroke, so what happens when somebody has got what we call hypertension, we now have an increased flow of blood in the vessels. Now what happens with hypertension is that it damages the walls of the vessels on the inside. So hypertension is not just about having high blood pressure and that's it. It actually causes havoc inside the body. So with regards to the brain, we have got vessels that feed different parts of the brain. Whenever somebody has been diagnosed with hypertension, what happens is, as a result of hypertension, it weakens the vessels on the inside of the brain.
So hypertension does more damage?
It does. It does. And that's the reason why if you have got hypertension, you're obviously being told you are at a risk of having a stroke. Now, if somebody has got hypertension, we know that because of the damage in the arteries and the blood vessels, when they are weaker, what happens with the arteries, there is some little tears, and whenever there is a tear, a blood clot may form. And once a blood clot may form, at some point it will block the vessel. And once it blocks the vessels, what will happen? It ruptures. The vessel ruptures.
So now you got stroke.
And now you have a stroke.
What is the difference between a stroke and a mild stroke? People talk about mild stroke. What is mild stroke?
Okay. So in terms of a stroke, you can have a mild, moderate, and severe. So when you had a mild stroke, it means that whatever the damage was there, it was mild. So it could just be, and usually some people could have a mild stroke without even knowing.
Scary.
Yeah. So, someone might say, I lost consciousness, for a couple of minutes and I started feeling dizzy. But then, then I was okay. Some would even report that, after that episode, they may report that they had some memory, like mild, memory loss. So, they can't remember certain things, or, they just find that it's a little bit difficult for them to remember things. So somebody with a mild stroke will differ from somebody who's had a severe stroke. So the difference will just be in how they present. So if you've had a mild stroke, you might not have a paralysis. And you might not have other signs that one with a severe stroke would have had.
So if somebody's got blood clots, that means what's going on there?
Yeah, so a blood clot can form in different parts of the body. Mm-hmm. So say, for an example, you have got hypertension and you have got tearing somewhere in the body, and in that part of the body, a blood clot forms. You may not be aware of it. That blood clot will be there, and it will end up traveling throughout the body. And as it travels throughout the body, it might end up inside the brain. And that's where one would end up with a stroke. If it travels to the heart, you'll have a heart attack. If it travels to the lungs, you will have a pulmonary embolism.
Because some people, I've met a lady, she's got stroke, but it's only one side. She's like this.
Yeah. So what that means is she had a stroke on the right side of the brain. And remember what I said the last time, that when it comes to the brain, the different sides of the brain are responsible for different sides, for the opposite sides of the body. So if somebody has got a facial drooping on the left, it means they had a stroke on the right side of the brain.
Oh, so stroke strike you in the brain?
Yeah, it's in the brain. And when it comes to where, it's something that is unknown to us.
So it's an end result. Like if somebody's got a paralysis on the left, that means stroke was on the right-hand side of the brain. It was
on the right-hand side of the brain.
Why is it so complicated?
That's just the nature of the stroke. And one other thing that I also want to mention about high blood pressure is it does not just cause stroke. It can cause memory problems if somebody has had a stroke. Because of high blood pressure, one is at a risk of dementia. Because also of high blood pressure, men in particular, they do know that they start having or experiencing erectile dysfunction. And the reason being that remember when a man gets aroused, there has to be an increased flow of blood in the vessels. Mm-hmm. Now, because of hypertension that has damaged the vessels, we don't have that sufficient, or because the arteries have narrowed. Mm-hmm. Due to the damage. Mm-hmm. Now there isn't sufficient flow. And there might be arousal, but you may find that a man is not able to keep the arousal for longer. Yeah, for sexual pleasure. The same thing happens with women who have got hypertension. They may experience some dryness, and also they may find that their sexual drive is not as it used to be. So that could also be one of the signs of a stroke, or if not a stroke rather, but of hypertension. So if you are experiencing those difficulties, get yourself checked, and if you have got hypertension, obviously get treated for that. And one other problem that hypertension causes is in women in particular. Ladies are told they need to take calcium, but nobody tells us why. So hypertension can cause the body to lose more calcium. So as we age, the body starts losing more calcium. But hypertension causes your body to lose more calcium.
So now, if you lose calcium, you are bound to have osteoporosis.
Osteoporosis, yes, definitely. You're bound to have osteoporosis.
So you can break easily.
You can break easily.
So it all boils down to hypertension.
Hypertension.
So it's not as small as we thought it is.
No, it's not as small as I have high blood pressure, I'm taking medication. It actually starts causing problems from the time that you have got hypertension. From the day, that's when your problems start.
What are the symptoms of stroke?
Okay, so in terms of the symptoms, obviously when it comes to stroke, you want the person to be treated as fast as possible. So it could be that a stroke is caused by a clot, a blood clot, or another thing, it could just be a rupture. So if it's caused by a blood clot, it's important that the person gets medical attention as soon as possible, so that the doctors can cause further damage. So the most important thing is to stop the clot. Now, in terms of symptoms, there is an abbreviation, be fast. So a person would complain that they're losing balance, and they may complain that, their eyesight is a little bit blurry. They may have facial drooping. So, you might find, the old lady lying down on the couch, and, the face seems to be drooping on the one side. It could be left or right. And also another thing, the arm. So important, ask them to lift their arm. So if the face is drooping on the left, just ask them to lift the left arm and the right arm. If they're finding it difficult to lift that arm, then it's a sign that they may be having a stroke. And then S stands for speech. So you may find that a speech is a little bit slurred, so they speak a little bit unintelligible, so you can't really make sense of what they say. And then lastly, it's time. So if you have identified any of those 5, it's time to call for medical emergency. So stroke is a medical emergency. It's not something that you can treat from home. If you suspect that somebody is having a stroke, you must call 911 or rush them to the hospital if the ambulance will take a little bit longer.
Basically, you have to be fast on that.
Be fast.
Viewers, keep those questions and those comments coming. We are attending to all your concerns, because this is serious business. I'm scared. I'm so scared about hypertension. Never before have I thought this was so serious.
Yeah, and you know what? It's not just hypertension, also sugar diabetes. Talking about sugar diabetes. It is found that people with sugar diabetes are 4 times at the risk of having a stroke.
As well.
Sugar diabetes.
Oh, so where are we going to run to now?
So you're going to run to taking care of yourself. Prevention is the best.
So meaning then it will be mostly the diabetes 2 people who are prone to.
Yeah.
Wow. Wow. And then kidneys?
Kidneys as well. So remember, when you have got sugar diabetes, obviously you will have kidney problems. So it depends on what is the cause of your kidney problems. If it's sugar diabetes, then obviously you are at the risk of having a stroke.
Sure. You know, I was always worried that maybe my pancreas is not releasing enough insulin, and when I found that I was, you know, diabetic too, I had a little bit of, you know, I had to relax a little bit because I knew that I was okay. You know, yeah. I can deal with that now. No, thank you so much.
Because, you know, the thing is, once you've been diagnosed with sugar diabetes, you have it for the rest of your life. So it's very important for you to look after, at that point, it's important for you to look after yourself. Yeah.
How do we treat this stroke?
Okay, so firstly, as I mentioned, stroke is a medical emergency. That means whoever's got a stroke must be treated, you know, in casualty or in the emergency room. Now, once a patient has had a stroke, they obviously will go to the hospital, and you know, they'll be given medication to stop the blood clot. If it's a cholesterol, if patient has got, you know, high levels of cholesterol, they'll be given medication for that. And also, most important, if it's hypertension, the patient will be given medication for that. And once the patient has been stabilized, they will now be transferred to a medical ward where they will recover. Now, recovery will depend on the severity of the stroke. If it's somebody with mild stroke, they might go to casualty, you know, have, you know, some observation, and then, you know, be discharged if they can go home. But if you have got somebody with a severe stroke, they may actually be in an acute phase for at least anything between 3 to 4, 5 days, where, you know, they're just lying there. Some may not be able to eat, so therefore they might have to be intubated, so they might have to eat via the tube, or you know, they might not be able to stand or sit up straight. They, you know, so it really depends on a patient. Once the patient is out of an acute phase, then they will start to receive rehabilitation. So what rehabilitation is all about is restoring the function which the patient has lost. So firstly, the physiotherapist will look at mobility. So if a patient is unable to walk because, you know, of the limb, the physiotherapist will give them exercises to help them walk. And now the occupational therapist will also come in. Now, if it was a left stroke, now you have somebody who's right-handed, they will not be able to eat by themselves. And this you will see in the ward, which is, you know, why a lot of family members will complain that, you know, their parents are not being fed and all of that. And that's because if, you know, they are unable to eat with their right hand, they will obviously require some assistance. So an occupational therapist will also treat based on the severity, you know, of their difficulties, and they will help them with exercises and fine, you know, motor exercises to help them, you know, pick food from the plate and feed themselves. And then there'll also be a speech therapist. So a speech therapist will come in an instance where a patient is unable to swallow. So also remember, because of the damage, their stroke may have affected a nerve that feeds, you know, the oral structure, and therefore a patient is unable to swallow. So a speech therapist will also come in, and the speech therapist will work on the facial paralysis, so some exercises to help with facial asymmetry, and then will also help with speech. So in terms of patient, they might have difficulty understanding. So you have someone who's had a stroke and you try to talk to them and they can't even make sense of what you're saying. Some will not be able to speak clearly, and some can speak clearly, and obviously that also depends on the severity of the stroke.
So meaning you might have 5 different physiotherapists or to help you, you know.
Yeah, there'll be one. There'll be
one for
in
speech,
terms of
one for
yes, the therapist. You mean
therapist? Yes, one for speech, one for maybe paralysis on your hands, walking and stuff like that.
Yeah.
Occupational. Who are those?
The occupational therapists, those are the ones that will help with eating, with going to the toilet, because sometimes a patient might not be able to sit on the toilet. So if, you know, there are other things that they need to give the patient at home to help them sit on the toilet, that's where the occupational therapist will come in. And also there might be, you know, you might have had a stroke while you are still working. So if you type, then the occupational therapist will also have to come in and assist you with such functions. If you were a driver, you may have lost, your strength. They will help with strengthening of your arm.
Okay. But does it affect the things you used to know? Can you still remember if you were driving and you can't drive anymore? Can you still remember how to drive? Can you still?
So driving is an automatic thing. So that can take some time. Yeah. But in terms...
Like a QWERTY keyboard, simple thing like a QWERTY keyboard. Can you remember how to... Because you will find that by the time you were hit by a stroke, you could, type without even looking.
Like 300 words per minute.
Per minute, yes. So what will happen after the therapy? Do you have to be taught how to do it, or it'll come naturally?
You will have to. So if you receive rehabilitation, your chances of recovery are better than if you did not. Because remember, so what happens with a stroke is that as soon as there's that interruption in the flow of blood to a part of the brain, let me make it a little bit practical. So there is a part of the brain that's responsible for speech, right? And then because of the stroke, that part of the brain lacked oxygen. That vessel ruptured, and what does that mean? There is no longer communication with that part of the brain. Now, the brain has got what we call neuroplasticity, so it is able to create other pathways where it can reconnect again and get the message. Now, in adults, it's obviously the prognosis might be a little bit poor because of the severity of the stroke. Young children, their neuroplasticity is better than in adults. Now, rehabilitation helps the brain to create another pathway because the initial pathway has been interrupted. So, in an instance where, for an example, you want to say the word fish, the brain sends a message to the different articulators, right? So you have to say fish, so you use your teeth and your lower lip. Now, if the message has been interrupted, you will not be able to remember how to say the word fish. Now, you'll have someone teach you how to say speech sounds. In terms of eating, as simple as, a message needs to be sent to the arm, right? To stretch, take a spoon, and different functionalities, and scoop and eat. The message that the brain is supposed to send to the arm is no longer there. Therefore, you need to get somebody who's going to teach you. And that's why rehabilitation takes longer, because it's not an overnight thing like your drug, which you give now and then you will see effects. Rehabilitation takes longer, and that's why it's important that if somebody has had a stroke, that the family takes them through the process of rehabilitation. So it can be at a hospital or it can be at a local clinic.
So where do the nerves comes in? When your brain sends the message, who transports the message to, let's say you want to eat something?
It's a whole nervous system.
The nervous system.
Yeah.
So the brain communicates to the nervous system for you to be able to get, maybe, let's say you want to cut a piece of meat with a knife and a fork. Mm-hmm. So the brain sends the message via the nervous system for you to be able to do that.
Yes, everything is controlled by the brain. From blinking.
Wow.
So yes, everything is controlled by your brain, and the brain sends message to and fro.
Oh, so it's like the mainframe.
It's the mainframe, yeah. Without a brain, I mean, if you don't have a brain, you are, and that's, you're literally useless.
Wow.
Yeah.
Wow, interesting.
Yeah.
There's other two things that I want to discuss after this one, but what can we recommend for prevention?
Okay, yeah. So, I mean, as I was going through some of the readings, in India has been found to be one of the countries that have got the highest rate of stroke for some reasons. So they focus a lot on prevention. What you want to do as an individual is to focus on prevention. Preventing stroke starts with preventing the causes of stroke. So obviously, if you are obese, you need to lose weight. If you have got high levels of stress, you need to manage your stress levels. You can take supplements to help you with that. Berry oil from Longrich can help you with that. If you have got sugar diabetes, make sure that it is managed. Remember, sugar diabetes does not only put an individual at a risk of stroke only, but kidney problems, and others.
Impotence.
Yes, definitely. Infections. We know people with sugar diabetes, their feet, blindness, their feet at cataract, glaucoma, and their feet are more at a high risk. We have seen that. So the most important thing is to prevent that which puts you at a risk of having a stroke. If you are young, don't wait until you are older to start taking care of yourself. We have got now younger stroke, as I have mentioned. And the thing is, you will never know whether you have got hypertension or not until you go and have it checked. And once you know, make sure that it's managed. If you are obese, chances are you might have hypertension. If you have got high stress levels, chances are you might also suffer from hypertension. So it's important for you to manage those conditions.
So hypertension, it's in the middle of everything.
It's in the middle of everything. It's the big devil.
Viewers, I hope you've been listening and taking your notes. We are waiting for your comments. We see your comments coming through. You know what? Let's just keep making sure that we stay tuned to this program, because this program changes lives. Not only are we talking about, you being healthy, we're talking also about wealth and everything else. So, Doctor, before we close this chapter, I got so many questions about bronchitis, which will later, if it goes untreated, leads to pneumonia and stuff like that. And right now, we have this coronavirus, and they all got something in common, with something that's got to do with the lungs and mucus, a lot of mucus that, the
pulmonary system.
So can you just, in a nutshell, just summarize, how we can take care of our lungs, and because we spoke about everything else, but we didn't actually touch on the lungs today.
Okay. Do you want us to finish on, the supplements that
Yes.
we can recommend
Yes.
for prevention,
Yes,
as well as
that's
somebody
right.
who's had a stroke? Then we will get into that. Now, in terms of stroke, obviously, once you've had a stroke, if it was hypertension, you will be on medication for that. However, Longrich supplies supplements. So supplements will obviously lack a lot of minerals and nutrients in our bodies, which are important for optimal functioning. So in terms of, as I mentioned, that because of hypertension, one might have memory problems and stress, high stress levels. A supplement that we recommend is sea buckthorn berry oil. Actual fact, berry oil is for it's got a lot of benefits. But if you have got high stress levels in particular, and you've had a stroke, would definitely recommend berry oil. And now, remember I did mention that because of hypertension, we run a risk of losing more calcium in our bodies. Now, a supplement that you would want to take is calcium, for obvious reasons, before and even after you've had a stroke. Now, in terms of preventing hypertension, brown tea, highly recommended for preventing hypertension. Remember, prevention is not just for people who are older. I can't stress enough that now we're having more and more young people who are suffering from diseases and illnesses that young people never suffered from. So brown tea definitely to assist with managing hypertension. And the alkaline cup. I often get asked, but what does alkaline cup have to do with stroke. Now, what alkaline cup does is water from the alkaline cup helps with what we call viscosity or flow of blood. So it helps with regulating the flow of blood, and as a result, helps with hypertension.
Would you say that because of viscosity, does it help, to thin the blood so that the blood can go through the veins?
It does not necessarily thin the blood, but it regulates the flow of blood.
Okay, because of the viscosity.
Because of the viscosity, yeah.
I'm getting educated.
Okay. And lastly, we have got the cordyceps militaris capsules. What do we call it? Zifozonke. Yeah. Now, in terms of cordyceps militaris, it has got a lot of benefits. So if somebody has already had a stroke, definitely recommend the cordyceps militaris. Assist with hypertension, assist with sugar diabetes, assist with those who have got heart diseases. However, very important, when it comes to cordyceps, I always advise Longrich members to talk to or to advise whoever that they're recommending the product to talk to their doctor. For example, if somebody is taking something like an anticoagulant or warfarin, blood thinner. Cordyceps is also a blood thinner. So it's important for them to check with their doctor first. Yeah.
So meaning, are you saying we need to, if we are taking a certain treatment, we need to say to your doctor, this is what I'm taking?
Yes, definitely. Unless you are only like, I don't take any medication, so I just take supplements. Okay. Yeah, but for you, you might want to consult with your doctor. I know you're off your high blood pressure medication now. Okay. All right. So also now going concerned with regards to before that, I forgot to mention. Remember earlier on I spoke about hypertension and how it affects libido. Pastor Jerry and Pastor Sfisa obviously touched on this when they spoke about main issues, and also we have got the libao for women, who are experiencing a decreased sexual pleasure, might be because of dryness and so forth. And lastly, in terms of the cordyceps, it also does assist in treatment of bronchitis. So for such patients who are concerned about, contracting coronavirus, remember there is no cure today, we haven't got any cure. But what we know is that if you have got a strong immune system, your chances of beating the virus are higher than somebody who has got a weaker immune system. We know that if somebody has got respiratory problems, they are at higher risk of death because of the nature of the COVID-19. So definitely would recommend the cordyceps for such individuals. Not just the cordyceps, but also the alkaline cup. So now we're answering the question. Now the alkaline cup. Remember, the alkaline cup consists in iron. And iron has also been proven to improve respiratory functioning.
Wow. So meaning berry oil, cordyceps, and alkaline cup is a must for every household.
It's a must for every household. But look, if you are healthy, you haven't got any health issues, alkaline cup and a berry oil should be sufficient. You can save the cordyceps for later. Yeah. And we have got lots of products. We have got green teas, we have got pink tea, we have got many products that individuals can select from.
Get in contact with us on this program, because we, every week or twice a week, we have things that we speak about that will blow your mind. We try to address most of the issues that we have, because we being the presenters of this show, we have so many presenters who are so capable, who are so well informed, to address the issues that we might have incurred in the past or even in the future. So stay tuned to this program. So what are your last words?
Okay, so last words are, we are here because we care. We are here because we believe that we can contribute towards prevention of the many diseases that we have in our communities. Please take care of yourself. Look after yourself. If you are a Longrich member and you have got a granny, a mommy, anyone who is at a risk of high blood of hypertension, they are ultimately at a risk of a stroke. Get them at least the brown tea or the alkaline cup. If you are obese, work on your weight. Your diet, if it's not right, also work on it. Take care of yourself. Keep safe, and God bless you. So I'm with Percy Madiba, the man who took on the bamboo challenge, and decided to share with the world what this amazing soap has done for him. I must say, I'm very impressed by the results.
Thank you.
How long have you been using the soap?
I've been with Longrich for 2 years now, so since I joined the business, I've been using soap.
Wow, so you are the product of the product.
Definitely.
And I must say, your face looks beautiful. It looks flawless, no blemishes, well moisturized.
Never blush.
How do you do that? Please don't blush. Tell us, how do you do that?
Look, I bath with the soap twice a day, but the beauty about it is that what I do is, actually I heard from one of my mentors who said, no, don't just bath, just put it in your face, leave it for some time, and then rinse it off.
Oh, so you're using it as a mask. Yes. Okay. Yes. And what are other uses besides, just using it as a mask? You mentioned earlier that you use it as an aftershave?
Yes, definitely.
Okay.
Because I shave almost every week.
All right.
Yes, it helps you to eliminate the
bumps.
There is a bump.
Wow.
Yes. Even the itchiness. Sometimes after shave, then you feel like, your head is itchy, you want to scratch it, but this one eliminates it. That's why I don't have pimples.
Do lots of men use aftershave?
I think almost everyone who shaves needs to use aftershave.
Okay,
because otherwise then it becomes uncomfortable and become itchy after you shave.
Okay, wow. Yes. So with the bamboo soap, you can get this beautiful skin.
In actual fact, I give it to my friend.
You give it to your friend?
Yeah, because he used to buy an aftershave.
Okay.
And he asked me, you know what, give that aftershave you always used. I said, okay, cool, I'm bringing it.
Wow.
But when I went to him, I went to give him this.
Wow.
And so I told him how to use it, and then he keep on now praising himself. He said, no, people are commenting on social media.
Wow. Now tell us, how did you get those results? I mean, do you use it once a day, 3 times a day?
No, not twice, only twice.
Only twice?
In the morning and at night.
Wow. Okay. And then what do you use together with the bamboo soap?
No, I use the SOD.
Just the SOD soap?
That's all. This is my 2 products.
Nothing else?
That's all.
Wow, this is amazing. Yep. Impressive.
Thank you.
I'm going to keep on using the bamboo soap.
Please do. In actual fact, I don't lie to you. In actual fact, I recommend this soap to everyone.
Okay.
I know you've got two types of soap together with your white tea.
The white tea, yeah.
I recommend both soap, but I love this the most.
Okay.
Yeah,
what do you love the most about it?
It's easy on my skin.
Oh, okay.
Yes, I don't feel the harshness of the even the smell. It's got such beautiful.
Percy, a lot of men don't really take care of their skin. I mean, some walk around with like a crocodile skin, scary. Why is that? Is there a reason for that?
I think. Okay, where I grew up, I'm from the village.
Oh, okay.
And
you'll explain later what that means.
So a man doesn't take care of himself, it means like he's hardworking and all those.
Oh.
Yes, so it's a bit charming.
Oh my goodness!
Yeah. But as I grew up, I realized, no, this is nonsense.
You realize,
no, man.
Okay.
Why can't it be clean?
So what's the benefit of a man looking after his skin? I mean, as a woman, this is our passport. So we obviously have to look after our skin.
I don't know how you look when you look at men, what you look at, but I believe that the face is a receptionist.
Okay.
So when a person have to have a conversation with you, they must first look at your face and say, what?
Wow.
I don't want to have a low self-esteem when you are talking now and I'm thinking you are counting my pimples.
Or looking at the cracks.
When you look at
the bumps.
Yes. So I want you to look at me, I'm thinking, she's looking at me. I don't know what but I'm confident that she's not counting the number of pimples that I've got.
Maybe men out there didn't know that as women we also look at their skin. So yes, we do look at your skin and we love to see that. We do. So we'd like to see that flawless skin, well moisturized, no bumps, no crocodile skin. Please take care of your skin, men. Thank you.
So then I'll bath 3 times a day now.
I think you're good.
I must.